Chapter 39, Care of Women with Reproductive Disorders. Premenstrual syndrome is also known as ovarian cycle syndrome. The premenstrual dysphoric disorder, PMDD, is a more serious problem and is described officially in the Diagnostic and Statistical Manual of Mental Disorders. This symptom criteria used to diagnose this disease process occurs between ovulation and the onset of menstruation and begins to improve between menstruation and ovulation. It does not present in the week after the menstrual period. The diagnosis for PMDD is based on specific symptoms in a pattern throughout greater than 3 months. Strategies for self-care include stress management, lifestyle changes, healthy diet that's rich in complex carbohydrates, fibers, avoiding simple sugars, salty foods, caffeine, and preventing hypoglycemia. Exercise may increase beta endorphin levels, which would help result to relieve the depression and the mood elevation. The most common symptom for this disorder is pelvic pain that radiates into the groin. There can also be backache, decrease in an appetite, vomiting, diarrhea, syncope, insomnia, or headaches. The pelvic examination for the patients routinely are normal. Healthcare providers may prescribe an oral contraceptive that will provide relief from menstrual discomforts, along with the advantages of contraceptive protection. Pelvic pathology for this includes endometriosis, endometritis, adenomyosis, pelvic inflammatory disease, obstructive urine or vaginal abnormalities, the presence of non-hormonal intrauterine device or uterine polyps, fibroids, or cysts. Which nursing intervention would help relieve symptoms of dysmenorrhea? Pelvic rock exercises, cold compresses, effleurage, low-fat diet, prostaglandin inhibitors. The answer is 1, 3, 4, and 5. So roughly 1 in 8 couples in the United States have difficulty getting pregnant or sustaining a pregnancy. The ability to conceive depends primarily on both partners having a normal reproductive physiology. They also need to have proper timing of intercourse. Repeated pregnancy loss may be caused by an abnormality in the fetal chromosomes that can result in spontaneous abortion, or abnormalities of the cervix or uterus, disorders of the endocrine or immune system. It can be caused by infections or environmental factors such as toxic agents. There are many reasons why women have difficulty carrying a pregnancy. The emotional impact of infertility is extreme. Some couples can become desperate to conceive a child. As a nurse, we need to assess whether the psychological intervention may be needed to assist the couple to deal with the stress that they are having at that time. Indications for a referral may need to include the inability to focus on anything other than the desire to have a child, and places tension in the relationship of the couple that can include blaming each other for the infertility. Assisted reproductive therapies are available, but they are often associated with ethical and legal issues. Things like the risk for having multi-fetal pregnancies, freezing embryos for later use, and the use of a surrogate mother. It is now possible for a child to have 5 technical parents: the sperm donor, the egg donor, the gestational surrogate, and the parents that will raise the child. In vitro fertilization and embryo transfer, this is when the woman's eggs are collected from the ovary, fertilized in a lab, and transferred into the uterus at the embryo stage. A zygote intrafallopian transfer. This is after in vitro fertilization. The ovum is then placed into the fallopian tube at the zygote stage of development. Therapeutic donor insemination. This is a donor's sperm that inseminates the female. Intracytoplasmic sperm injection is the injection of one live sperm directly into the mature egg. A surrogate mother can be inseminated with one partner's sperm or implanted with an egg that is fertilized by the partner's sperm in vitro. The egg is then transferred to the uterus of the surrogate mother, and she becomes the gestational carrier. The aging process and the decrease in estrogen levels can cause thinning of the vaginal walls. It will also cause dryness and itching of the vagina. These changes may result in painful sexual relations, which is known as dyspareunia, and can lead to increased susception to infections because the vaginal pH increases. Osteoporosis is a decrease in bone mass that can cause the risk of bone fractures. The decrease in estrogen that occurs during menopause slows the bone growth, and the bone will deteriorate and thin before new bone growth can occur. Postmenopausal women are at an increased risk for coronary heart disease because of changes in lipid metabolism and a rise in the total cholesterol level. Diet and exercise may help minimize the effects. Hormone replacement therapy with estrogen and/or progesterone was once the primary intervention to help reduce the discomforts of menopause. Research has shown that this therapy can increase the risk of developing clots, stroke, heart attack, gallbladder disease, and uterine as well as breast cancer. It is not widely used anymore. There are some complementary and alternative therapies that have been helpful in relieving specific discomforts. Eating certain things, increasing soy products, vitamins B, C, and E, they have all been shown as being helpful to relieve menopausal discomforts. These are increased risk factors for osteoporosis. Vitamin D is necessary to be ingested in order for the woman to be able to digest and use the calcium supplement. They need to be taken concurrently. Various health screenings are maintained throughout the woman's life cycle. So with pelvic relaxation, it's the muscles and ligaments and fascia that support the pelvic floor. They weaken, and the pelvic organs will start descending toward the vaginal orifice. This can affect the bladder, which would be a cystocele, the rectum, which would be the rectocele, The bowel would be an enterocele, or the uterus would be a uterine prolapse. An obstetric history needs to be obtained that reveals the number of vaginal deliveries and the size of the infants. This may contribute to the relaxation syndrome. A history of stress incontinence or constipation may also be an indicator for the relaxation syndrome. Non-surgical management for this will be Kegel exercises to strengthen the muscles of the pelvic floor. Also, increasing fluid intake, increasing fibers to prevent any constipation, and maintaining an optimal weight. Hormonal therapy may be prescribed. There is also a rubber or a plastic ring that can be fitted into the vaginal opening. It's called a pessary, and this can help provide support to the pelvic structures. Dysfunctional uterine bleeding is bleeding that occurs at times other than the normal menstrual cycle, or it is abnormal bleeding during menstruation. Abnormal uterine bleeding may be caused by anovulation or failure of hormonal changes during the menstrual cycle. Routinely, it occurs at the beginning or at the end of the reproductive years. Bleeding from continuous estrogen production can occur due to a thyroid dysfunction, polycystic ovary disease, infection, trauma, or neoplasm. Medical management depends on the size and location of the fibroids, the symptoms the patient's experiencing, the desire for future pregnancies, and how near the woman is to a natural menopause. In mild cases, monitoring and supportive care will be given to relieve symptoms as necessary. Uterine artery embolization involves the injection of special pellets into selected blood vessels that supply the fibroid, resulting in shrinkage of the fibroid. A myomectomy is the removal of the tumor from the uterine wall. The medical necessity for a hysterectomy would include cancer, unmanageable infections or bleeding, or serious birth complications like in a ruptured uterus. Endometriosis usually undergoes the same changes as normal endometrium during the menstrual cycle and may bleed at the time of menses. This will cause irritation, pain, and the formation of adhesions. Robotic surgery is surgery that's performed by the surgeon's manipulation of the robot's hands and electronic monitors. There are benefits for robotic surgery, and it includes a shorter operation time, shorter hospitalization, a faster recovery, and it is a very sophisticated surgery. The acidic environment of the vaginal vault is maintained by estrogen levels and the presence of lactobacillus. Risk factors that can alter the bacterial flora and pH environment within the vagina would include aging, poor nutrition, use of medications such as steroids, antibiotics, or douching. The diagnosis of the specific condition can be accomplished by culturing the vaginal discharge or the lesions. They can do blood tests for specific infections, or they can do a colposcopy or biopsy of the lesion. Drug therapy is prescribed based on the formed diagnosis. The nurse will teach the woman about the risks and prevention of genital infections and the treatment necessary for the specific type of infection. Toxic shock syndrome is a rare but potentially fatal disorder most often caused by strains of Staphylococcus aureus that produce toxins. These toxins can cause shock, coagulation, defects, and tissue damage if they enter the bloodstream. Toxic shock syndrome is associated with the trapping of bacteria within the reproductive tract for a long period of time. The nurse will teach the woman about hand hygiene when inserting tampons and the importance of changing tampons every 4 hours. Vulvar intraepithelial neoplasia refers to the growth of abnormal tissue on the vulva that may be precancerous. Some symptoms might include red, brown, or white patches on the skin of the vulva. HPV vaccine, known as Gardasil, Gardasil 9, or Cervarix, reduces the incidence of this condition. Cervical cancer requires a hysterectomy with a possible bilateral syngo-oophorectomy, followed by radiation and chemotherapy. The HPV vaccine is given at or before puberty in adolescence and may prevent the type of HPV infection that causes cervical cancer. The most common malignant tumor of the female reproductive tract is endometrial cancer. This is a slow-growing cancer that most commonly occurs after menopause. There are specific symptoms that might be seen with ovarian cancers: abdominal bloating, abdominal or pelvic pain, feeling full quickly or having difficulty eating, and urinary frequency or urgency. There are some breast disorders that are benign and can be seen throughout the female population. Some of these will be removed with surgery. The patient reports finding multiple smooth, well-delineated cysts in her breasts that are tender during the premenstrual phase. The nurse should include which instruction: eliminate alcohol and caffeine, apply a cold compress, reduce fat in the diet, take non-steroidal anti-inflammatory agents, consult a physician immediately. The correct answer is 1, 3, and 4. In the United States, approximately 1 in 8 women, or 12% of the female population, will develop breast cancer in their lifetime. The development of breast cancer is believed to be related to estrogen and progesterone. Breast cancer in men is rare, but it does occur. It's usually diagnosed at a later stage because of lack of awareness that men can actually develop breast cancer, and also lack of routine screening. Older age and liver disease are found to be contributing risk factors. Treatment that might be used for breast cancer might be a lumpectomy, which is a removal of the tumor only. They may do a partial or a segmental mastectomy, which is a removal of the tumor and a portion of the surrounding breast tissue and the axillary lymph nodes. They may do a simple or a total mastectomy, which is removal of the entire breast and the axillary lymph nodes. They could do a modified radical mastectomy. This is a removal of the breast, the axillary lymph nodes, and the lining over the chest wall muscles. A radical mastectomy is done in extreme stages, and it requires a removal of the breast, the axillary lymph nodes, and the chest wall muscles under the breast. Plastic surgery of the breast can be performed to reduce the breast size, which would be a reduction mammoplasty, enlarge the breast size, which would be an augmentation mammoplasty, or reconstruct after breast cancer surgery, which would be a reconstruction mammoplasty. Women are commonly concerned about the change in their appearance after breast surgery. Postoperative care can include pain management, observation for signs and symptoms of infection, and the continued support and educational information. Because the breast tissue is very vascular, bleeding may be a problem. The surgical dressings need to be observed frequently during the first 48 hours after the procedure. Lymphedema is a swelling of the arm that sometimes occurs after breast cancer surgery because of the damage to the lymphatic tract, and this causes the congestion of the lymphatic tract. A woman that has had a mastectomy and a lymphadenectomy, their affected arm should never be used for IVs, blood pressures, because lymphedema can become a chronic condition. There are various risk factors for breast cancer. Familial traits are one. They say obesity, inherited specific genetics, not having children,